Hi, my name is Louis Melançon. I'm a PhD student in the Communication Studies program at McGill University. I've been lucky enough to work with Serene-risc since last January. I've been commissioned over the summer to write a short report on cybersecurity in Canadian health institutions for Serene-risc. The idea is to provide a very wide overview of the current state of cybersecurity in Canadian health institutions, as well as the latest recommendations from scientific research. Keep in mind, I understand I'm talking to experts, of course, but this report was written for practitioners specifically. To be clear, although I have been studying cybersecurity norms and practices for many years now, I am not an expert in the field of healthcare per se. That said, I hope you'll find this presentation something new and interesting you had not encountered before. You can find the report on the Serene-risc website for more details and all the sources. And I also included some shortened links in the slides so that you can easily find the relevant sources. So the plan of the presentation. So we are going to review the current cybersecurity practices in the Canadian health sector according to a survey from 2017. We are going to see the 5 major cybersecurity threats and the recommended measures against them. Insights from academic research, as I said, and then review a very general overview of the Canadian regulation, more specifically on privacy laws related to healthcare. The 2017 Canadian Survey of Cybersecurity and Cybercrime paints a disturbing picture of current cybersecurity practices in the health sector. Canadian health businesses seem to have been spared so far, as 87% reported not being impacted by any cybersecurity incidents in 2017. But however, they also seem very much unprepared and ill-equipped to face any breach, attack, or systems failure. As you see on the slide here, 78% of large health organizations, 67% of healthcare businesses overall, with only between 1 and 5 employees dedicated to cybersecurity, 15% provide cybersecurity related training to their employees, and half reported monitoring their networks and systems. How can you even know if you have been breached if you don't monitor your network and systems? The WannaCry ransomware attacks of spring 2017 were a watershed moment in demonstrating the concrete dangers of cybersecurity incidents for healthcare organizations. The attack affected more than 200,000 computers in at least 100 countries, but it had a particularly severe impact in the United Kingdom, where 80 out of 236 National Health Service trusts were directly affected. Thousands of appointments and operations were canceled, as hospitals and clinics were either infected or had turned off their systems as a precaution. Ambulances carrying trauma patients had to be diverted from affected institutions, risking lives. Ransomware attacks have continued to affect healthcare organizations since, of course. For instance, in Canada, there were 3 Ontario hospitals that were targeted in September 2019. In the case of the Michael Garron Hospital, the malware spread from a single corporate laptop to infect most systems of the hospital, including electronic medical records, taking 10 days to restore access. Even more recently, in September of 2020, a ransomware attack in Düsseldorf, Germany, forced the hospital transfer that directly resulted in the death of a patient. Ransomware attacks are very severe, of course, but represent only a small portion of the potential cyber threats facing health organizations. For instance, researcher Sarah Lewis of the Open Privacy Research Society discovered in November 2018 that sensitive medical information of patients admitted to certain Vancouver hospitals was being broadcast unencrypted by hospital paging systems. Patients' names, age, gender, diagnosis, attending doctor, room number, could be trivially intercepted by anyone in the greater Vancouver area. Vancouver Coastal Health, which is the affected institution, reacted months after the researcher's private disclosure, after Lewis contacted journalists and the breach appeared in the news. The hospital network consequently affirmed it believed patients' data was protected and had been unaware of the radio broadcasting component of their pager system. Asset management of technological equipment is another difficult challenge healthcare organizations are currently facing, among many others. Any discussion of cybersecurity within healthcare environment must stem from the principle that healthcare security is a patient safety issue. Cybersecurity has historically been viewed, some experts have said, in the healthcare industry as a problem confined to information technology departments. Incidents are approached reactively rather than proactively and are considered detached from patient care. As the WannaCry attacks have demonstrated, data breaches and cyber attacks can have direct and dire consequences for health services. Experts have observed that healthcare as a professional field has an open sharing culture which, while appropriate to its primary mission, of course, complicates information security considerations. Healthcare personnel may, for instance, leave workstations unlocked or unattended in order to expedite collaboration with their colleagues. And until the very recent news of cyber attacks around the world affecting healthcare, security professionals had difficulty convincing health organizations of the very real dangers they were facing. Cybersecurity incidents can affect sensitive data, of course, but as medical equipment is increasingly connected to hospital networks, they can now also affect patient health. Healthcare organizations are prime targets for cyber attacks and data breaches. They represent a unique sector in terms of the breadth and depth of the information they collect and store. In addition to sensitive health data of their patients, health organizations also may possess financial information such as credit card numbers, bank accounts, business intelligence, intellectual property such as medical research, vaccine research, for instance, in the current use, as well as national security information related to emergency procedures. The combination of highly vulnerable systems, significant financial resources, and potentially life-threatening consequences for patients makes medical providers an especially attractive target for malicious attackers. The Health Industry Cybersecurity Practices Report, published in 2018 for the US Department of Health and Human Services by a task group of more than 150 healthcare and cybersecurity experts, identified these 5 cybersecurity threats as the most prevalent and impactful for the health sector. As we discussed, ransomware is present in the list, but there are many other threats. First, email phishing attacks. So email is a major vector for phishing and malware infection in general. Ransomware attacks we have just discussed, loss or theft of equipment or data, lost or stolen devices from hospitals, other healthcare organizations may result in the unauthorized access and dissemination of private information. Data loss. So an employee could be tricked into divulging private information or could accidentally leak important data. That employee could also deliberately access sensitive information to use for personal gain. Attacks against connected medical devices. Disruptions affecting any device used for the diagnosis, treatment, or prevention of a medical condition could severely impact patient care. Public Safety Canada, in its Fundamentals of Cybersecurity report, recommends 4 major safeguards, which they say would prevent the vast majority of exploits for any critical infrastructure. Application whitelisting. As you know, of course, that means limiting what software can be executed on a computer according to a curated list of pre-approved applications. Then they recommend to use modern operating systems and applications to benefit from the latest security protections and fixes. They also recommend to patch within a 2-day time frame of a high-risk vulnerability being made public. And then they also recommend to restrict administrative privileges to limit the potential damage resulting from a cyber attack. The US Health Industry Cybersecurity Practices Report provides recommendations in line with its assessment of cyber threats, which are the 5 threats we have already listed earlier. And those are tailored to health organizations. That's why I have also included them here. Cybersecurity measures and their scope must correspond to an organization's scale and resources, of course. So first, email protection systems. As we just discussed, email is a major vector, and organizations should properly configure their email servers, anti-spam, antivirus filtering, and so on. Endpoint protection systems. So they are the desktops, the laptops, the workstations, mobile devices used in a healthcare setting. Organizations should adopt full disk encryption, limited usage of administrator accounts, as well as rigorous provisioning practices. Identity and access management. So organizations should establish clear procedures for access provisioning, transfer, and revocation, as well as implement large and complex passwords for privileged accounts. Data protection and loss prevention. Healthcare organizations must thoroughly understand where the data resides, how it is used, and how it is transmitted within and outside their network. IT asset management. So IT assets should be rigorously managed for the complete duration of their life cycle: procurement, deployment, maintenance, and decommissioning. And the recommendations continue. Network management. Organizations should deploy firewalls, network segmentation practices, such as providing a guest network for visitors, and ensure the physical security of network devices. Vulnerability management. Organizations should assess risks and exposure relative to measures 4 to 6. Patch their systems rapidly and implement penetration testing. Then, Security Operations Center. So, not all attacks can be prevented, and accidents do happen. It's important not only to prevent accidents or attacks to happen, but also to know what to do when they actually happen, because they will happen. Organizations should establish clear remediation effort guidelines, detailed responsibilities, and information sharing protocols. Medical device security. Because of their highly regulated nature, of the special skill required to modify them, and their life-critical quality, traditional security measures cannot necessarily be deployed on a medical device. Making configuration changes or applying a security patch to a medical device without direct approval from the manufacturer, for instance, is ill-advised and potentially very dangerous. Cybersecurity policies, finally. Policies should make clear to the workforce of health organizations how and why they are expected to behave with regard to cybersecurity. Organizations should clearly define roles and responsibilities, establish acceptable email practices, official guidelines for personal device use at work. Some of the academic research now. So, Jodali and Kaiser, and then 2018 study of the dynamics of cybersecurity capabilities development in US hospitals have identified its two most effective strategies, they say, neither of which entail pursuing more resources. This is interesting. So the two priorities of chief information and security officers, according to their research, should be to reduce endpoint complexity and to improve internal stakeholder alignment. As equipment systems and networks become larger and more interconnected, complexity increases and cybersecurity capabilities correspondingly erode at an increasing speed. They give the example of moving to cloud-hosted services and maintaining stricter policies on technology procurement to reduce endpoint complexity. Decision-making is similarly very complex within health organizations. Issues are debated between the board of directors, executives, IT, bioengineering, as well as care worker staff. All these people need to be on the same page when it comes to security measures. Interviewed experts suggest that experiencing a cyber crisis, having security issues articulated in terms of patient harm, and designing systems with unobtrusive security measures are the three keys to success in convincing cybersecurity skeptics. Another interesting research. So, Zhao and colleagues have published a study of the impact of a ransomware attack's downtime on residency training in a US hospital. They reported that residents accustomed to having constant online access to health information and having not worked before the digitalization of hospital systems were caught off guard by the attack as electronic systems were shut down. You all know when we were young, it was easy to remember, for instance, many different phone numbers of our family, of friends, but today I cannot even remember any phone number that are in my cell phone because you're used to having access to them all the time. So the authors recommend that medical education should include preparedness for cybersecurity threats, similar to what already exists for other disasters, such as natural catastrophes and infectious outbreaks. Cybersecurity attacks happen and continue to happen and will happen again, and medical personnel should be prepared for them. Then, Canadian regulation. Canadian privacy laws are integral to the healthcare cybersecurity landscape, since they regulate how institutions can collect, use, and disclose patient information. There are 2 federal privacy laws enforced by the Office of the Privacy Commissioner of Canada. There is the Privacy Act, which covers how the federal government handles personal information, the Personal Information Protection and Electronic Documents Act, PIPEDA, which covers how businesses handle personal information. PIPEDA establishes how private sector organizations can collect, use, and disclose personal information in the course of for-profit activities in Canada. Organizations covered by PIPEDA must generally obtain an individual's consent when they collect, use, or disclose that individual's personal information. People have the right to access their personal information held by such an organization or to challenge its accuracy. The following provincial acts, as you can see on the slide, define the additional responsibilities that health information custodians bear in their handling of health data. They have been declared substantially similar to PIPEDA with respect to health information. PIPEDA does not apply to organizations that do not engage in commercial for-profit activities, or to Alberta, British Columbia, and Quebec, which have general private sector laws that have been deemed substantially similar to PIPEDA. In conclusion, cybersecurity in healthcare institutions is a major challenge. Canadian organizations are currently unprepared, as we have unfortunately seen. Cybersecurity is a multifaceted issue. Of course, ransomware attacks happen, are very, very severe, but there are more threats to think about and to prepare for. Email is an especially potent vector of phishing and malware infections, at the very top of the list of the threats and of the recommendations, the recommended measures to take. Then a few recommendations from the latest research. As we have just seen, reducing endpoint complexity, improving internal stakeholder alignment, and including cybersecurity incident preparedness as part of medical education. If you want to read more about the subject, as I said, you can download the report on the Serene-risc website. Thank you very much for your time, and I'm looking forward to your questions. Thank you.